Hello, welcome to Anatomy DAHAR series. Today's topic is the palate, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. The palate. What is palate? Look at the diagram. Palate is a horizontal partition separating the nasal cavity above from oral cavity below. Its upper surface forms the floor of the nose and the lower surface forms the roof of the mouth. The lower surface is a slight shallow dome to adapt the convex dorsal surface of the tongue. The anterior two-thirds of the palate are made up of bones called hard palate, anterior two-thirds, and the posterior one-third is mucomuscular structure and called soft palate. The hard palate. This is the inner surface of the right nasal cavity. This is maxillary bone and this is palatine bone. This is hard palate. If you look very carefully, the anterior three-quarter of the hard palate is formed by the palatine process of the maxilla, number 1, and posterior one-quarter is formed by the horizontal plate of the palatine bone, number 2. The upper surface of the hard palate is forming the floor of the nasal cavity. So it is lined by respiratory mucosa, that is pseudo-stratified ciliated columnar epithelium with many goblet cells. Lower surface of the hard palate. This is the lower surface of the hard palate, which is the roof of the oral cavity we are looking from below. The lower surface of the hard palate is horseshoe-shaped. It is bounded anterior and on each side by alveolar process, which carries the upper teeth. The attachments of the periosteum to the lower surface of the hard palate is secured by multiple fibrous tissue called Sharpie's fibers. The lower surface has many transverse palatine rugae, which is folds or wrinkles, and a median longitudinal ridge, which is called palatine raphe. Look here, this is the roof of the oral cavity. This is palatine raphe. Anteriorly, the palatine raphe ends in a small pit called incisive fossa, which formed between the horizontal plates of maxillae immediately behind the 4 incisor teeth. Incisive fossa. This is the sagittal section. This will be the incisive fossa. Into the incisive fossa, right and left incisive canal open. Each canal opens into the corresponding nasal cavity. They transmit the nasopalatine nerve and greater palatine vessels. Hard palate, forming the roof of the mouth, we are looking from below. This is third molar tooth, left side and right side. Medial to the third molar tooth, we have greater palatine foramen. Behind greater palatine foramen, we have 1, 2, 3 lesser palatine foramen. Through the greater palatine foramen, greater palatine nerve and artery comes down. They run forward. Artery is lateral to the nerve. Through the lesser palatine foramen, lesser palatine nerve and vessels comes out and supply the soft palate. This is posterior nasal spine projecting from the posterior border of the hard palate along the midline. Arterial supply of the hard palate. It is supplied by the greater palatine artery, look at the diagram, which is a branch of the third part of the maxillary artery. It comes out through the greater palatine foramen, runs forwards, lateral to the corresponding nerve, and in front it enters through the incisive canal and passes into the nose. Venous drainage of the palate. The veins drain to the pterygoid plexus of veins and pharyngeal venous plexuses. Nerve supply. The greater palatine nerve passes down through the greater palatine foramen together with the artery and supply the palate, except the anterior most part of the palate, which is behind the four incisor teeth. It is supplied by the nasopalatine nerve, which comes down from the incisive canal. Lymphatic drainage. Most of the upper deep cervical nodes will drain to this area, which is Robbins level 2, and also drain to the retropharyngeal nodes. Soft palate. We have two diagrams here. The upper one is the palate. You can see this part is the bony part, hard palate. Soft palate is a mobile flap that hangs down from the posterior margin of the hard palate. Hard palate, we have two surfaces, superior nasal surface and inferior oral surface. Continuation of it, soft palate also consists of superior surface and inferior surfaces. Look at the second diagram here. This is the palate. This is the pharynx. We have three parts. This is the nasal cavity. The upper part of the pharynx, which is behind the nasal cavity, is nasopharynx. The middle part of the pharynx, which is behind the oral cavity, is the oropharynx, and the lowest part is the laryngopharynx. During swallowing, the soft palate raised. The posterior part of its upper surface makes contact with the posterior wall of the pharynx to close off the nasopharynx from the oropharynx. The soft palate consists of an aponeurosis, that is a flat tendon, and a bulk of mucus and serous glands. Let's see the diagrams. It's a continuation of the soft palate. This is the posterior view. This is the sphenoid bone. Below the body is the nasal cavity, and this is the aponeurosis of the soft palate, and this is the tongue. This is the oral cavity. Now we are going to talk about the aponeurosis of the soft palate, which is attached by 5 pairs of muscles. This is the aponeurosis of the soft palate, attached by 5 pairs of muscles, 2 pairs coming down from above and attached to the aponeurosis. That means descend to the aponeurosis from above. Another 2 pairs descend from the aponeurosis, go down below, and another 1 pair project behind the aponeurosis. So what are the 2 pairs of muscles that comes down from above and attached to the soft palate? Number 1, tensor palatine muscles. Number 2, levator palatine muscles. They both come down from above and attach to the aponeurosis. Next 2 pairs of muscles that descend down from the aponeurosis go down. They are number 3, that is Palettoglossus muscles. Number 4, Palettophyryngeal muscles. And finally, one pair of muscles project behind from the aponeurosis, that is musculus uvulae. We are going to talk in detail. To study the muscles of the soft palate in more detail, we need to know some important anatomical landmarks. I am going to present those in two diagrams, diagram of the sphenoid bone and base of the skull in two slides. This is the sphenoid bone, posterior view. This is the body of the sphenoid, lesser wing and greater wing of the sphenoid, and these two processes on each side are lateral and medial pterygoid plates. Lateral and medial pterygoid plates. This is posterior border of the medial pterygoid, which extends down and becomes hamulus of the medial pterygoid. At the upper part, between the lateral and medial pterygoid plates, there is an area, boat-shaped fossa called scaphoid fossa. This little small spine is spine of the sphenoid. These three structures with astragus are important to know for further study about the muscles of the soft palate. This is the segment of the base of the skull, inferior view. We are going to continue the previous slides here. This is medial pterygoid plates. This is posterior border of the medial pterygoid plates. This slides we are emphasizing pharyngobasilar fascia, which arises from the posterior border of the medial pterygoid plates of one side, which sweeps around behind and comes to the posterior border of the medial pterygoid plates on the opposite side. This fascia surrounds the upper part of the nasopharynx. It is behind and on each side of the nasopharynx. This is temporal bones, and this is petrous part of the temporal bone. And this is also called quadrangular area. This is auditory tubes, one on each side, enter into the nasopharynx above the pharyngobasilar fascia. What is important here is this quadrangular area here, that is petrous part of the temporal bone, is where levator palatine muscles is originated. That means levator palatine muscles is originated deep to the pharyngobasilar fascia. That means in the uppermost part of the nasopharynx. But what about the tensor palatine muscles? Tensor palatine muscles is originated outside, that is lateral to the pharyngobasilar fascia. So it is originated around here, that is the tensor palatine muscles. So these two muscles, tensor palatine is outside the fascia, levator palatine is inside the fascia. This little spine is the spine of the sphenoid. Two pairs of muscles that descend from above to the soft palate. They are tensor and levator palatine muscles. Let's see the diagram first. This is posterior view of the sphenoid bone. This is medial pterygoid plates. This is posterior border of the medial pterygoid plates. And this is the hamulus. This is scaphoid fossa, auditory tube, and spine of the sphenoid. Now let's talk about the tensor palatine muscles. A pair of muscles each consists of two parts. The vertical muscular part here and horizontal aponeurotic, that is the flat tendon part. Each part is triangular in shape. You can see here triangular in shape. The vertical muscular part is outside the pharyngobasilar fascia. We have already mentioned about that one. It arises from the scaphoid fossa, lateral part of the auditory tube, and spine of the sphenoid. The upper attachment, which is the wider attachment, is the base of the triangle. Continuation of tensor palatine muscles. Here is tensor palatine muscles. This is vertical muscular part which lies between the medial and lateral pterygoid plate. This is hamulus of the medial pterygoid plate, and this is the aponeurotic part. The muscle fibers of the muscular part converged and comes down and forms a tendon at the apex of the triangle here. And they hook around the hamulus of the medial pterygoid plate, and the fibers will spread out as the aponeurotic part. The anterior fibers attach to the posterior border of the hard palate, and the posterior fibers hangs free behind. When the tensor palatine muscle contracts, the aponeurosis becomes tense and stable platform. The muscles attached to it function to the maximum capacity. In swallowing and yawning, tensor palatine pulls upon to open the auditory tube, permits equalization of air pressure between the middle ear and pharynx, that is the external pressure. This action is impaired in children with a cleft palate, which could lead to middle ear problem. Second pair of muscles coming from above is levator palatine muscle. Look at the diagram. This is posterior border of the medial pterygoid plates. Here is hamulus. This is the attachment of the pharyngobasilar fascia along the posterior border of the medial pterygoid plate. Levator palatine muscles each arises from the quadrangular area on the inferior surface of the petrous temporal bone. I have mentioned this one in the earlier slide. That is from the roof of the nasopharynx deep to the pharyngobasilar fascia. Deep to the pharyngobasilar fascia. A pair of muscles descend medially and forwards and are inserted to the upper surface of the palatine aponeurosis. Actions of the levator palatine muscle. This V-shaped pair of muscles pull the palate upwards and backwards. Also open the cartilaginous auditory tube. Two pairs of muscles descend from the soft palate are Palettoglossus and Paletopharyngeal muscles. Palettoglossus, a pair of muscles each arises from the undersurface of the palatine aponeurosis, coming from the undersurface of the palatine aponeurosis. Each is covered by mucosal layer and submucosa together form paletoglossal fold. Continuation of Palettoglossus muscles. This is the soft palate. This is the Palettoglossus muscles. This is the tonsillar fossa. Palettoglossus muscles is covered by mucosal layer and submucosa. Together form paletoglossal fold, or also known as paletoglossal arch. It descends in front of the palatine tonsillar fossa. This is the tonsillar fossa. It descends down anterior to the tonsillar fossa. It inserts to the side of the tongue at the junction between the oral cavity and oral pharynx. Action of the Palettoglossus muscle. They serve as a sphincters at the oropharyngeal isthmus, narrowing the transverse diameter of the isthmus. It also raises the tongue. Paletopharyngeal muscles, a pair of muscles, each consists of two heads, anterior and posterior head. Anterior head arises from the posterior border of the hard palate and anterior part of the upper surface of the aponeurosis. The posterior head arises from the upper surface of the aponeurosis. Two heads join and descend deep to the mucous membrane and submucosa as the paletopharyngeal fold or arch. It forms the posterior pillar of the tonsillar fossa. Below this muscle blends with stylopharyngeus and salpingopharyngeus muscle. They inserted to the posterior border of the thyroid lamina and its horns. I'm going to show you that in next slide. This diagram is right longitudinal pharyngeal muscles seen from behind. This is right side. The paletopharyngeus muscles. This is the one coming from the palate, coming down behind the tonsillar fossa and blends with number 2, that is stylopharyngeus muscles, and number 3, salpingopharyngeus muscles. They come down and inserted along the posterior border of the thyroid lamina and their horns, superior and inferior horns. Action of the paletopharyngeus muscles is elevate the larynx and pharynx in swallowing. Pillars of the tonsillar fossa. This is a transverse section of the oral pharynx. Looks from above. This is anterior. This is tongue. This is palatine tonsil. This is tonsillar fossa. Each tonsillar fossa is bounded by a pair of pillars, anterior and posterior. Anterior pillar is formed by the Palettoglossus fold. This is the anterior pillar formed by Palettoglossus muscles forming Palettoglossus fold or arch. The posterior pillar is formed by paletopharyngeal muscle forming paletopharyngeal fold. It forms the posterior pillar. They are covered by mucosal layer and submucosa. Paletopharyngeal sphincter. This is the sagittal section of the palate. This is hard palate. This is the soft palate. Behind we'll see some muscles. This is superior constrictor muscles. This is paletopharyngeal muscle. Just now we mentioned about that one. Now let's see some uppermost fibers of the paletopharyngeal muscles run horizontally backwards around the sides and posterior walls of the nasopharyngeal isthmus. It is at the level of first cervical vertebra. During the act of swallowing, these muscle fibers contract, form a ridge called perseverance ridge. It narrows the nasopharyngeal isthmus. At the time, soft palate is elevated and comes in contact with the perseverance ridge. In this way, nasopharynx is shut off from the oral pharynx and prevent regurgitation of food into the nasal cavity. Perseverance ridge is hypertrophied in cases of complete cleft palate. See below. Musculus uvulae. This is the fifth pair of the muscles of the soft palate. Look at the diagram here, posterior view. This is aponeurosis of the soft palate. This is musculus uvulae. It is covered by mucosa and it is located on the upper surface of the palatine aponeurosis on each side of the midline. They extend from the posterior nasal spine of the palatine bone. Arterial supply of the soft palate. They are lesser palatine branch of maxillary artery, ascending palatine branch of the facial artery, and palatine branches of the ascending pharyngeal artery. Venous drainage. Drains to the pharyngeal and pterygoid plexus of veins. Lymphatic drainage. Drain to retropharyngeal nodes and upper deep cervical, that is jugulodigastric nodes, Robbins level 2. Nerve supply of the soft palate. A. Motor supply. All the muscles of the soft palate are supplied by the cranial root of the accessory nerve via the vagus nerve through the pharyngeal plexus, except tensor palatine muscle, which is supplied by the nerve to the medial pterygoid, which is a branch of mandibular nerve. B. Secretomotor nerve supply. It derived from the superior salivatory nucleus in the pons, comes via nervus intermedius of the facial nerve and through the greater petrosal nerve. C. General sensory. Middle and posterior palatine nerves, which are branches of the maxillary nerve, through the pterygopalatine ganglion. Also receive fibers from the glossopharyngeal nerve. D. Special sensory, that is taste supply. From the oral surface through the lesser palatine nerves, the greater petrosal nerve, geniculate body of the facial nerve, and to the nucleus of the solitary tract. Functions of the palate. The soft palate controls the narrow junction, that is the isthmus of the pharynx, close or regulate their size. They are, number 1, at the junction between the oral cavity and oral pharynx while chewing, so that respiratory passage is not affected in breathing. And number 2, at the junction between the oral pharynx and nasopharynx while swallowing, so that food does not enter into the nose. Clinical correlations. Lesions of the motor nerve may lead to deviations of the uvula opposite to the site of the lesion, that is clinical sign. The arch of the palate is flattened on the site of the lesion. Nasal regurgitation of the liquid or food. Gag reflex. It is a protective mechanism. Elevation of the palate and contraction of the pharyngeal muscles when the palate, tonsil, posterior part of dorsum of the tongue, or posterior wall of the pharynx are touched by an unfamiliar object. The afferent sensation is brought by the glossopharyngeal nerve, and the efferent motor action is carried by the vagus nerve. However, the passage of food over these areas does not cause the reflex due to conditional familiarity. Development of the palate. The face develops from 5 processes around the primitive mouth stomodium. This is the face. This is the primitive mouth stomodium. These processes are: number 1, frontal process, a single process coming down from above. Number 2, maxillary processes, 2 processes, one on each side. They are dorsal portions of the first pharyngeal arch. And number 3, mandibular processes, 2, one on each side. They are ventral portions of the first pharyngeal arch. The frontal process gives rise to the primary palate, the premaxilla. The secondary palate develops from the palatine process of the maxilla. 2 palatine processes fuse in the midline to form the secondary palate. This is the secondary palate. Primary and secondary palates fuse and the hard palate is formed. Primary and secondary palates fuse and form the hard palate. The incisive foramen marked the junction. This is the one. The nasal septum extends downwards and joins the hard palate. Figure B. This is the nasal septum. The soft palate develops from the posterior edge of 2 secondary palates. The development of the palate is from anterior to posterior. Therefore, the uvula is the last structure to be developed. The embryogenesis of the muscles of the soft palate is still unsettled. Developmental abnormalities of palate. Defects in fusion between the primary palate, premaxilla, and right and left secondary palates, maxillary processes, give rise to clefts. They are fissures or elongated openings in the palate. Cleft lips and cleft palates are common developmental defects. The incisive foramen is considered the dividing landmark between the primary and secondary palates. The degree of variation leads to varieties of cleft palate. Types of cleft palates. Complete cleft. It has 2 types. Unilateral complete cleft, that is, complete cleft on one side. Primary palate does not fuse with the secondary palate on one side. Primary palate fails to fuse with the secondary palate on one side, always associated with the cleft lips. Bilateral complete cleft. Right and left secondary palates fail to fuse between the two. Right and left fails to fuse between the two. And also with the primary palate, also fails to fuse with the primary palates. So the cleft is Y-shaped cleft. Incomplete or partial clefts. Cleft of soft palate, cleft of soft palate and uvula, and cleft of uvula by fit uvula. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.